I so appreciate the comments that were made, and just with all due respect, I would encourage us to focus on not the general idea of COVID and masks, but the issue in this bill, which is about masking our children. And what I greatly appreciate and believe this to my core is that every single one of us in here believes that child safety is paramount. And so I thank you for that, and I share that with you. And I know I've heard some really good comments about the science and what we know. And I think particularly when you're dealing with children, you're dealing with a developmental period, very different than adulthood. And so you're balancing social, emotional, educational needs with pure physical health and, of course, mental health, as has been discussed. And so I think what's critical in this is that we really look at what we know and what we don't know. And so when we talk about science, right, good scientists put forth a hypothesis, and then they test that. And then based on what they've learned from their data, they resubmit a hypothesis and try again, right? That's the process. In this case, the reality, and I know this is hard, and Representative Cunningham's exactly right, there's confusing messages out there. But in this case, the data on masking of children is absolutely not scientifically peer-reviewed data to defend masking outcomes of children in schools with COVID. And I won't get into, this is obviously not the forum for that, but, the confounding variables, whether there were control groups, whether someone was vaccinated, was separated out. These, and many of these studies self-admittedly disclaim this. They're looking for trends. And again, science should do that. They're finding things that need to be pursued, but they're not conclusions. And so I think it's incumbent upon us as leaders in this state to look at what the truth is, and the truth is the studies don't support it. What we do know, and what the truth is the data around the mental illness, and you've heard that discussed already, the suicides, just in, skyrocketing rates in children and adolescents. Again, this is our focus. It's not adults. It's not any other discussion around COVID. It is children in schools and masks. That's it. And so what we know about children in schools during COVID is skyrocketing rates, right, of suicide, of homicide, of ER visits, of substance abuse. That's what we know. And we know that they have fallen behind dramatically in schools, but that's a separate subject. We need to balance the reality of what we know with what we're mandating. And so, again, let's please rally around child safety, but we cannot subject our children of all to what we don't know, hoping we're right. What we do know is the studies don't support it, and these children deserve that their parents can make those decisions for them. And I really urge you to give that deep consideration. Thank you.